It's like that feeling you get as a patient, you know, like when you're stuck waiting forever for an appointment,
Yeah, I've been there.
or you're like wrestling with a medical bill that looks like it was written in hieroglyphics, or even something as simple as needing a prescription refill.
Ugh, prescription refills. Don't even get me started.
It's like it shouldn't be this hard, right? But it feels like you're drowning in paperwork and red tape, and none of it seems to have anything to do with actually, getting better.
Yeah, I totally get that. You're hitting on something that I think a lot of people experience. You go to the doctor to get help, and then you end up tangled in a whole web of administrative stuff that just adds to the stress.
Exactly. It's that whole behind-the-scenes world of healthcare administration that we're diving into today.
Oh, this is going to be good.
We're talking about the stuff that most patients don't even see, but it takes up a ridiculous amount of time and energy for healthcare professionals.
Right, and that ultimately impacts the kind of care they can provide.
I'm talking about things like prior authorization. You've heard of that?
Oh, yeah, where doctors have to jump through hoops to get insurance companies to approve treatments that patients need.
It's insane. And then there's all the insurance verification, making sure that a patient's coverage is actually still active.
It's a never-ending cycle.
And then, of course, you've got the mountain of appointment scheduling, rescheduling, follow-ups, all that jazz. It's enough to make your head spin.
Yeah, and it eats up so much time that could be spent with patients.
It's not just a little bit of time either.
Hmm.
In prepping for this, I was reading some pretty startling statistics.
Oh, yeah.
Some studies show that depending on their specialty, doctors can spend like 40% of their workday on administrative tasks.
40%, that's almost half their day.
I know, right? It's crazy to think about all that time that could be spent actually diagnosing and treating patients.
It's like they're spending almost as much time on paperwork as they are in actual medicine.
So let's talk about the fallout from all this administrative overload. One thing that seems pretty obvious is that it leads to delays in patient care.
Definitely. If doctors and their staff are swamped with prior authorizations and insurance paperwork, it's gonna push back appointments and slow down the whole process of getting treatment approved.
And it's not just the practical delays. Think about the stress this puts on healthcare workers.
Oh, absolutely. Being a doctor or a nurse is already a super demanding job, and then you add on this mountain of administrative work. It's no wonder burnout is such a huge issue in healthcare.
It's like the system itself is working against them, in a way.
Yeah, you could say that. The U.S. healthcare system is, well, it's complicated.
To put it mildly.
You've got all these layers of insurance regulations and documentation requirements for compliance. And, I get that these things are meant to ensure accountability and fairness, but it creates this massive administrative burden that takes healthcare professionals away from what they're actually passionate about caring for people.
It's like the system is trying to fix itself, but it's kind of making things worse in the process.
Right. Like a car with too many safety features that makes it impossible to drive.
The perfect analogy.
Yeah.
So for this deep dive, we're not just going to complain about the problem.
Oh, good. Because I'm ready for some solutions.
Me too. We're going to explore a potential way forward, a solution that popped up in the research we did for this episode.
I'm all ears.
The magic word is outsourcing.
Outsourcing, you mean like having someone else handle those pesky administrative tasks?
Exactly. Imagine taking things like prior authorization, insurance verification, even a lot of the appointment scheduling, and handing it off to experts outside of the clinic.
Okay, now that's an idea I can get behind. But let's break it down. What are the actual benefits for a healthcare practice if they decide to outsource these tasks?
Well, for starters, there's the potential for some serious time and cost savings.
Yeah, that makes sense. If the clinic staff aren't spending hours on the phone fighting with insurance companies, they have more time to do other things like, actually talk to patients.
Exactly. And on the financial side, it can be a real game changer. One of the providers mentioned in the stuff we were looking at, Staffingly, Inc., they suggest that outsourcing admin tasks can save up to 70% compared to having an in-house admin team.
70%, that's huge.
Right. It's like finding a $100 bill in your pocket.
I'd take that any day. But, beyond the financial benefits, there's also the impact on the doctors and nurses themselves. Less administrative work has got to lead to less stress, right?
It's a no-brainer. When you take away that constant pressure of paperwork and deadlines, it frees up mental energy for doctors and nurses to focus on what they do best, patient care.
It's like taking a weight off their shoulders.
Exactly. And when healthcare providers feel less overwhelmed, they're less likely to burn out, which is a huge problem in healthcare.
And happier, less stressed doctors and nurses means better care for everyone.
It's a win-win. And, we're seeing this major staffing shortage in healthcare right now. Outsourcing could be a smart way to make the most of the existing workforce.
Oh, for sure. If you can take some of the administrative burden off of nurses and medical assistants, they can focus on the tasks that require their specific clinical skills.
It's about working smarter, not harder.
Exactly. And making sure that patients are still getting the best possible care, even with these staffing challenges.
Now, one specific type of outsourcing that's becoming more and more popular is using virtual medical assistants. Have you heard much about those?
Yeah, they're pretty cool. It's like having a personal assistant for your healthcare needs, but they're all online.
It's like having a digital sidekick.
Haha, exactly. They can handle all sorts of things remotely, answering patient questions, scheduling appointments, managing electronic health records, even processing paperwork.
It's like having a whole extra set of hands without actually having to hire more people.
Right. And the beauty of it is it frees up doctors to spend more time face-to-face with their patients, which is where their expertise is most valuable.
It's about using technology to create a more efficient and patient-centered healthcare system.
Definitely. And it's not just for big hospitals either. Smaller clinics and even independent practitioners can benefit from this kind of outsourcing.
Yeah, that was something that really surprised me when we were researching this. You tend to think that these solutions are only for the big guys. But it turns out that smaller practices often face the same administrative challenges, but they have fewer resources to deal with them.
Outsourcing can really level the playing field. It allows smaller clinics to streamline their operations and improve their efficiency without breaking the bank.
And it means that they can continue to provide that personalized care that's so important, especially in a smaller setting.
It's about taking away the headache of admin work so that doctors can focus on building relationships with their patients.
It's funny how this all ties back to World Health Day. We're celebrating healthcare professionals and all the amazing work they do, and one way to truly support them is to find ways to reduce their administrative burden.
It's about recognizing that their well-being is just as important as the well-being of their patients.
If we can create a system where healthcare workers feel less stressed and overwhelmed, everyone benefits.
Absolutely. A healthy healthcare system starts with healthy healthcare providers.
So let's do a quick recap of all the good stuff we've talked about today. Outsourcing administrative tasks in healthcare has the potential to save a lot of money, boost productivity for everyone involved, reduce stress and burnout, and ultimately lead to better, more patient-focused care.
And those benefits all work together to create a more sustainable and efficient system. It's about taking a holistic view of healthcare and recognizing that even the behind-the-scenes stuff plays a vital role.
So, on this World Health Day, as you're thinking about all the incredible healthcare professionals out there, consider the impact of those unseen administrative tasks that they're juggling every day. And remember, there are solutions out there.
For anyone listening who might be feeling buried under a mountain of paperwork, there are companies like Staffingly, Inc. that offer specialized outsourcing solutions. They can help with things like virtual medical assistance, prior authorization support, insurance verification, you name it.
So if you're in the healthcare field and feeling the administrative squeeze, don't be afraid to reach out and explore those options. It can make a world of difference for you and your patients.
You know, it's kind of inspiring to think that by streamlining the administrative side of things, we can actually help create a better, more human-centered healthcare system.
That's a great point. It's about putting the focus back where it belongs, on caring for people.
To all the healthcare heroes out there, thank you. You're the backbone of our communities, and we appreciate everything you do.
Absolutely. Happy World Health Day, everyone, and thanks for joining us for this deep dive.
It's been a pleasure.
Until next time, stay healthy out there.
And take care of yourself.